Well, good morning, everybody. Thank you so much for being on the call today. We're excited. It's the first time this illustrious young man is on our call today. We're excited about having him on. I got a chance to meet him April 23rd backstage at the Dallas event. One of my goals was to go back there and meet up with him also. Got backstage with him. We were breaking bread back there before they had lunch, and we chit-chatted for about 10 or 15 minutes on April 23rd, and I was just amazed at what he was talking about that day. And so we got him on the call today. So today is called Learn the Value of Impact. He's a co-founder of Impact Healthcare. We're excited to have him on the call. And then after he gets finished, we got a few questions. He's already got the list. We asked everybody to send him in early so we can have him to a point in the format so he can get to him. And with that said, let's get our guest on today. None other than the CEO and founder of Impact Healthcare, the great Phil Chrysler.
Hey, how are you, sir?
Fantastic.
That is the goal. Thank you so much, Mr. Thomas, for allowing me to spend some time with you and your awesome team today. We appreciate the honor. I have a couple friends of mine that are from the Impact staff. Our medical director, vice president of billing, Dr. Maharaj, is on. She's going to talk a little bit about some of the features, benefits of Impact, and then answer some questions. And then our VP of operations, Eileen Ryan. So you're going to hear from the key staff today. So let's go into it. All right. If you haven't heard of healthcare sharing, like me, up until 4 or 5 years ago, I hadn't heard of it. But it's been around for decades, okay? And mostly through these very good religious-based organizations. They've done a great job serving their members. But my only challenge or critic with them is they only allow people of a particular faith into their community, which is great. They serve that. We just decided to do something, I think, better, and that is become a ethic-based healthcare sharing organization, which really allows us to expand who we offer and who we allow into the community, any race, any religion, any backgrounds, anyone of that nature. So it just allows us to let more people take advantage of healthcare sharing. So if you don't know, again, healthcare sharing is a risk reward concept. The risk is you're relying on your fellow community members to continue contributing on a monthly basis to their monthly share amount, right? The majority of that monthly share amount gets allocated in member-owned accounts. Key difference. We'll talk about this in a little bit. Member-owned accounts that gets paid to eligible medical expenses. Okay, so the risk, that's the risk, right? No healthcare sharing organization can provide a guarantee because the healthcare sharing organization isn't paying for the medical expenses. We're just arranging it on behalf of the membership. So that's why some people say, wow, there's no guarantee. Well, there isn't, because that's why. I would also cite plenty of examples from the so-called insurance companies that do provide a guarantee. But if you go out of network, or you go here, or you do that, all of a sudden that is not guaranteed anymore. So the reward, though, is 30, 50, sometimes 70% less on your monthly healthcare costs. So that's a significant advantage. And here's what's great about the risk reward concepts as it relates to direct selling, and specifically with ACN. There's no better entity to make sure customers continue to come into Impact in North America than ACN, right? That is what you guys do. You go out and you get customers to subscribe to services. You do it better than anybody else in the direct selling industry. So you should feel good. I know we feel good. We're already in good shape with our reserves. In fact, so good a shape, last November and December, we didn't need to collect the normal amount of monthly share. So we said, let's give our members a break in these particular months, especially when they could use it and repurpose that money. They got to keep over $625,000 of their money. Okay, we didn't collect it from them. So we're doing some things that have never been done in healthcare sharing, certainly never been done in health insurance. And a lot of that we can do because we're not for profit. Okay, so we don't have the financial conflicts that for-profit insurance companies do. We have no conflicts, no profit motives with our members, okay, with our providers, with our shareholders. There's no shareholders, right? I'm an employee just like everybody else at Impact. We're paid fair market value, and that's it, regardless of how great or not so great the entity does. And it is doing great. You're going to hear from Dr. Maharaj in a second, but right now we haven't closed the month of June, but in April and May, we processed nearly 2,500 medical bills, okay, in those 2 months. And we've done that. Her team has done that in 19 days. So we get the bill, we reprice it, and then adjudicate it and send it to the provider 19 days later. So, wow, you're seen as a very good paying customer to your provider. And we want that. We want that for you because we believe it's member-centric, and we want that for the brand of Impact. And we also want that because we think it helps lift up the value and credibility of contemporary healthcare sharing when practiced right. Okay, so very, very excited about, again, being a not-for-profit entity. It benefits you as our members a great, great deal. The Department of Health and Human Services have said this, and this is staggering, right? 5% of the population drive about 50% of the medical spend that occurs in this country. So what does that mean? Wow, the vast majority of us are really overpaying for something that we don't use or rarely use. So in comes healthcare sharing to drive down those costs, and specifically with Impact. Here's why. Again, we have the love thy neighbor faith ethic, which allows us to, again, welcome more people into the community. We have a leading best-in-class technology platform. So Impact was birthed with 100 combined years of healthcare sharing experience from 2 former president and CEOs and their C-suite people that scaled one of the largest good religious-based good healthcare sharing organizations still in existence today. They went from 13,000 households to 130,000 households in a matter of 3-4 years, okay? So they got to see the good, the bad, the ugly that goes on, and they built this best-in-class technology platform from that perspective and from what regulators want to see in pure healthcare sharing. And Impact was the very first beneficiary of that platform. And we're the only ethics-based healthcare sharing organization in the United States to deploy that. So you should feel good about, yes, Impact may be new to healthcare sharing, but we were architected and built by using the best-in-class technology, people that have scaled another healthcare sharing organization and have 100 combined years in healthcare sharing. So you should feel very, very good about that. Another thing, member-owned account. See, our members' own account, you don't send us your monthly share amount, okay? You deposit it and fund it in your own member account, okay? You give us permission to pull on a monthly basis the administration costs and the program fees, because we got to pay the vendors, including our newest marketing partner with ACN. But then the majority of that money stays in your member-owned account. We have all these thousands and what will be tens of thousands, and ultimately, I think hundreds of thousands and probably millions of reserves that are distributed throughout all of our members. That allows us to match and allocate eligible medical bills with you. So you're notified. Okay, this is what's cool. You're notified. You got 3 days, we publish it, and then we pull the money with you and a bunch of other people and then send it off to the provider 19 days later. So truly practicing contemporary, pure healthcare sharing in that regard, not taking receipt of the funds. That's a big no-no in that regard. So Another great thing is you get to see any doctor you want. So that's awesome, right? We're not restricted on a network or anything like that. And because of our technology platform, it's very transparent. So for the first time in healthcare, you're seeing how 100% of all the money's moved in an organization. So phenomenal transparency. And this decentralized peer-to-peer approach is increasing. We see what it's doing in other industries. We've seen what Uber and Lyft have done, Airbnb have done, Bitcoin, right? All of that. So the time is right for America through ACN IBOs to disrupt healthcare, right? And put the power, the transparency, the visibility back to the person who is there designed for. That's our member. It is, we have great choices for individuals, for families, for seniors, and we're going to talk about this later, groups up to what we think should be about 49, no larger than that, for reasons we'll get into in a little bit. But it's a comprehensive program, preventative services, maternity, accident, illness, injury. Dr. M will talk about the free telemedicine, industry leading prescription drug pricing in that regard. So we're built as a very comprehensive program. So I don't want you to think it's just for this or just for that. No, it's very wide for our members. Okay, in what kind of and serves their healthcare needs in so many ways, shapes, and forms. But we're looking, obviously, who we're looking for is anyone who's relatively healthy, that pay all or most of their health care. There's a good chance, really good chance, that we can help them save money once they understand how we're built, how we serve our member, right? There's a good chance we can help them save money and help you along the way earn some money by helping them save money. How great is that? I've heard it called compassionate capitalism, and that is alive and well today, my friends, with Impact Health Sharing. And we need it. I mean, the opportunity today to serve others is upon us. 80% of the United States adults ranked lowering their healthcare costs as their number one concern. Okay, I just got this report from Kaiser Health News about 10 days ago. It talks about how 100 million people in America are saddled with healthcare debt. 100 million people. Okay, most of it is unreported because it's on their credit card. But so obviously it's a serious issue, and it's only going to escalate. I would argue. Why? Because we're seeing more people do what you do. The quit rate with employees is an all-time high, right? So they need access to affordable healthcare solutions. It's really probably the number one reason why they stay at their job, but they're quitting at an all-time high because they're doing what you're doing. They're going to be an ACN IBO or going to have multiple gigs that to provide for them and their family. So so they're going to need access, right, to affordable healthcare solutions in that regard. At the same time, right, there's undoubtedly we're in an inflationary period. Arguably, stagflation is right around the corner. Recession is predicted by both sides of the political aisle. It's just a question of when. Perhaps it'll be a soft one, perhaps not. I don't know. These type of conditions are really difficult to predict, but I do know this inflationary period and this stagflation and whatever type of recession we have, right, in that regard, people are going to be more open than ever to look for ways to reduce costs. And we already know they've ranked healthcare as their number one way that they're looking to reduce costs. So you have every trend on your side right now, every single trend, including with the quit rate being high. What are employers looking to do? Keep their employees, but yet they can't afford to provide them health insurance. Well, you have now a solution for them as well. So literally every trend is on your side. And here's the cool thing with Impact. If that employee leaves their job, either they were asked to or they decided to. An impact membership is portable. They get to take it with them when they leave. So something truly unique that we're able to provide. Here's the positive side amongst all this terrific news. Healthcare sharing memberships already in our good brother and sister religious-based organizations over the last decade have grown 1,000%. So now here we come along in this period, allowing more people to join. You are set up to win in such a big way. You just got to decide you want to go out there and do it. We've tried to make it easy by creating a system where it works like Sphere does, where you register the lead and then we contact them, we report the statuses, and then we tell them what impact is, healthcare sharing is, and what it isn't. And the thing you need to do is make sure you submit good leads. Miss Eileen Ryan's going to talk about that in a moment, and get accredited, right? The very first thing you need to do is get accredited, because we want you to have a general sense, a general understanding of what healthcare sharing is. Okay, it's not that we're asking you to go out there and be healthcare sharing salespeople. No, we just want you to have a good understanding of what it is. So there's not, you have 100 million people right now that are saddled with healthcare debt, and then you have about 90 million Americans that don't have access to group insurance, who don't have any insurance, or who are underinsured, that they are open and becoming more and more open in this economic cycle that we're in about reducing the cost of their healthcare coverage. So friends, I couldn't, we are in such a great position to help yourself and to help others. And now I'd like Dr. Maharaj to talk a little bit about some of the key features she appreciates and loves that about impact that potentially separate us from, again, our certainly health insurance, but our other good religious-based healthcare sharing organizations. So Dr. Maharaj, take it away.
Hi, everyone. Thank you so much for having us. As Phil mentioned, I just want to highlight a couple things that I believe really showcase the value within impact health sharing, and kind of what I believe shows how much better we are than some traditional health insurance, and definitely other healthcare sharing organizations. And the first thing with that is the fact that we share into wellness, and not just share into it. Actually, we provide you with one wellness visit for free for each member, and that's annually. So it's basically to use towards getting your annual physical. We understand that it's important for you to do that, get to see your provider, make sure that everything is going well. So that visit is completely free of charge to you, the member, and you can essentially go the first day that you sign up. So there's no waiting period or anything like that. In addition to that, usually when you go see your provider for like your annual physical, they are going to prescribe you some blood work, usually check your cholesterol, your blood count, etc. So in addition to giving you that free visit, we're also giving you $150 to use towards getting that blood work done. And we do have a list of labs that you can use that towards. And again, it's usually that routine stuff that your provider is going to have you or ask you to get, check your cholesterol, your complete blood count, etc. Another great thing that we do offer is we share into therapy. Each member is allowed to have 50 visits per member per membership year. So it's 50 for you. If your spouse is on the plan, then they get an additional 50. And you can use that towards chiropractic care, physical therapy, occupational therapy, speech therapy, respiratory therapy, and even cardiac rehab. And to me, I think that's a really great benefit, because you're looking at, things like chiropractic care and even speech therapy that a lot of traditional insurance companies don't provide you with. So that's something that I feel like is really great. In addition to that, we also share into home health care. And we allot 40 visits per member per membership year. So again, similar, if it's you and your spouse, they get 40 visits, you get 40 visits. It's a great benefit that a lot of insurance companies don't even provide. And so imagine you go to the hospital, you have a stroke, unfortunately, or you have a major surgery and you need a little bit of assistance at home. Impact does share into that. So you don't have to worry so much about, if you need a little extra hand at home. And probably one of my most favorite things that we do have is the free telehealth. It's an extraordinary savings, and this is completely free of charge. There's no provider fee, no copay, no nothing. It's 100% free. You use it through our platform, which is through your member center. It's a wonderful tool. I've been sending a lot of people to the telehealth through the telehealth channels lately. Couple examples. My brother-in-law had what he thought was pink eye. He didn't want to run out and go see his provider, take time off from his workday. He was easy, signed up, did the telehealth visit during his lunch break. They sent him the prescriptions that he needed to his pharmacy. It was excellent. I've used it before. Sometimes in the middle of the night, your kid is not well. It's not emergent to the point that you need to go to the emergency room or even urgent care, but it's not something that you want to sit on till the morning. Easy, jump on telehealth. You can see the provider there. They can send the prescription into your pharmacy. It's a tremendous savings. It's a tremendous benefit. And again, completely free of charge. So it's, again, one of my favorites. We also share into mental health, which again, some healthcare sharing companies don't, and most definitely traditional insurance companies, not all of them do either. And we do provide virtual mental health. So again, similarly through telehealth, but this time it's with a mental health provider. It's a great option. We also share into outpatient mental health. So if you need to go see a counselor, you need to go have some therapy, that's included, and we share into that as well. And probably my second favorite thing that we do have is our prescription savings plan. Tremendous, tremendous value. And I can tell you from firsthand experience, taking the prescriptions and comparing what I would have paid if I had traditional insurance. A lot of times my savings is $10, $15, and that's per medication. Most recently, one of our consultants, actually, she joined Impact. Her husband gets prescriptions through the insurance that they had before. And with the insurance plan, they were paying like something around $130. And then with our prescription savings plan, that came out to be, I want to say it was either $23 or $33. So that's like $100 savings right off the bat with one medication. So we hear a lot of those stories, and I can tell you firsthand, our prescription savings is phenomenal. A great, great thing that we have. The other thing that I just wanted to touch on is that with Impact Health Sharing, we're constantly making changes to better what we offer, better what we share into. We do take feedback from our members very seriously, and we definitely take those things into consideration. Being a not-for-profit organization allows us to make those changes. Of course, we need to make sure that we're financially responsible because we are kind of like the gatekeepers of the share dollars. We don't own them, but we do have to make sure that, you know, we're being financially responsible. But most recently, we share into maternity. There's $150,000 limit per pregnancy. And prior, the baby was included in that $150,000 limit. But again, taking the feedback and kind of putting ourselves in new parents' shoes. Imagine you had a baby that's in the NICU. You're going to pretty quickly, depending on what's going on, go through that $150,000 limit. So we have since excluded the baby from that. So if the baby is added to membership within 30 days of their birth, they get the same sharing limits as any other member. We even remove them from the first 60-day limit as well. So that way the baby can get all the care that they need. Parents don't need to worry about it. But the reason why I say that is really just to highlight the fact that we are constantly taking feedback, constantly trying to improve and enhance what we offer. And we're happy to be partnering with ACN and with all of you. So thank you.
All right. Thank you so much, Dr. M. Okay, so I have some questions that I'll answer the first one. The second one, we're going to bring Miss Eileen Ryan, the VP of Operations for Impact. But the first question is, what is the best way to introduce this product to big companies, and what type would be ideal for the Impact Health Share benefits, specifically where they have found the most success in the past? Well, I can tell you, we launched our group program last fall. Okay, and we have a lot of groups in it already. Most are small businesses. That's really who Impact is designed to serve in that regard. I think our average group size is probably 7 in that regard. So once you get over 50 employees, there's different mandates federally that you have to have, and combining it with impact could get more cumbersome. We're really architected. We really serve the small business community the best in that regard. So I would say anybody under 49. And the question is, how do you get them to be interested? And it's just, are you open for alternative ways to reduce your healthcare costs? If so, I've run across this great organization that I can have them reach out to you. I know they're doing it for many, many others that I've heard. Don't know much about it, but I could have them call you. Simply, if they're open for that, you register that lead and our team will do that. And which brings me to Miss Eileen Ryan, because the second question is this: what is being done to resolve the delayed times for impact responding to leads? Question. Okay, Eileen, take it away on that one. I would say we're not having delayed times. You know, and when we first launched Impact, we said within 3 days you will receive a call. But I'm going to let Eileen unpack this a little bit more. So, Eileen, you with us?
Yes, I am. Hello, ACN. Thank you. And you are correct, Phil. We are responding to our leads as promised within 3 days. Less than 5% are being responded to in more than 3 business days. And those are, you know, business anomalies that happen. Somebody's out sick. And so it's been delayed by a day. But we're very proud that it's less than 5%. So I really wanted to talk about managing expectations. So let me show you my screen. Can I share my screen? Give me permission there. Okay. All right. So you send your lead to your ACN storefront and they fill out the quote request, put in the oldest member of the family's date of birth, how many folks that they want to become members in the family, and a quote is generated. And then they scroll down and they fill out this lead request form. So you'll see here, it'll say, thank you, you'll be receiving an email and a call soon, right? So what you want to instruct your leads to do, your prospective customers, is to fill out this lead form. And during that time, knowing that it will take up to 3 business days for us to reach out to the lead, to let them know that here that they need to take a look at the FAQs, check out this brief video about impact, check out the guidelines. All of this information is going to help prepare them for their call so that they can have their questions prepared for when the enrollment specialist contacts them. Now, here's what happens. We reach out and we give a call. And if we don't reach that person, immediately an email is sent. Hey, sorry, it's all automated. Sorry that we missed your call. Here's my name is Eileen. Here's my meeting calendar. Please click here to calendar an appointment, a call with me at a time of your convenience. Now, why that's important is because we clicked this submit form and we got to this leads page. Well, what you don't see is underneath there is your IBO number. Your IBO number is tracked throughout this whole process. And so when they click that calendar invite, that call, every interaction, every touch point is connected to your IBO number. So let's say they choose not to schedule an appointment. Their life is too busy. They just want, you know, to kind of play that little phone tag game. Most people don't. Most will click the calendar and schedule a time of their convenience to call. But still others have such a structured life that they have elected to scroll down here and book a 30-minute consultation. Now, let me tell you something about those is we are running at about a 33% no-show rate. So folks are booking those 30-minute consultations, but 33% are not showing for them. And so what that does is the leads that we have promised to make those outbound calls to within 3 business days, that ties up these representatives who are sitting there waiting and they don't know that somebody's not going to show until they don't show. Then they have to, you know, get back in and start making those outbound leads. As you could imagine, it just disrupts the whole process. So I would tell people that only those who really have like such a structured life that they need to schedule a 30-minute appointment, those should be the only folks that are doing that. And then please ask them to be mindful and to, attend that appointment. So we're running at 5%, less than 5% in reaching out to the leads within the 3 business days. Follow this process during that time. Instruct your prospective customers to go over these materials. And please, when they are ready to sign up, after they speak to an enrollment specialist, they're sent a thank you email with their quote and a link to the application. When they're ready to sign up and enroll in Impact, please direct them back to that email because your IBO number is tracked there, and have them click that application link and sign up through there. If they circumvent that and leave the lead system, which is not their fault because they're a prospective customer, they don't know this, only you know this. If they go directly to impacthealthsharing.com and click join now and enroll, which we know that a few hundred people have done, that creates a problem for you all because it's not tied to your IBO number anymore because they went outside of this process. So the process is fill out the lead request, know that we will contact you within 3 business days. After the first contact, they'll get an email with a link that they can schedule a call at a time of their convenience, and do not direct anybody to go to impacthealthsharing.com. We appreciate the partnership so much. The excitement is tremendous. This month to date, we've made over 2,400 contacts with our leads, and we're very excited about all your excitement, and that you're going out there and helping people get affordable health care with Impact.
All right.
Back
Thank you so
to you.
much. Thank you,
Thanks.
Eileen. Appreciate that. Thanks for making us better. And here's the good news, right? As we approach 2 months being, with ACN in the launch, things will get better. We will learn from each other. We will learn from the IBOs, and we will pivot and make some changes. And that brings me to question number 3 is, in the future, will there be an option for customers to sign up directly from the site without a consultation call? I can say this, that we are actively in discussions with ACN on alternative ways to make the process simpler and easier to reduce some of those challenges that we're seeing with missed appointments or appointments that are just simply training calls. Hey, I'm not interested, but I want to know what you want to say. So we're trying to create new ways to do that. And I think we've got something coming soon in that regard. Okay, explain what it means that there's no guarantee to pay medical bills. So I touched on this a little bit earlier. Remember, it's the entity of Impact, or really any healthcare sharing entity, cannot provide a guarantee because it truly is based on the monthly voluntary contribution of the members that contribute, to the monthly share amount, and then everyone takes a portion to go, go towards the bills, and that's how it gets done. So we cannot, nor any healthcare sharing organization can truly provide a guarantee. We just can't do that. And then I would go back to talk to many friends and neighbors about a so-called guarantee with health insurance, and you'll see that isn't happening either, okay, in that regard. But that's really the reason why. Again, ACN is built to help us overcome that because of the customer acquisition model that you guys are leading the direct selling industry with. So we're in good shape prior to ACN coming. Now we're only going to be in better shape on that topic. All right. So next question, when will we be able to offer Impact to businesses, schools, and other organizations? Great question. I know this is actively being discussed with ACN, and that is coming, in my view, very soon in that regard. We had some data issues that Impact needed to work out reporting, and that is now on a very positive track. So I expect then we will be announcing here in the very short-term, near future about offering groups, opening that option. Okay. This next question, Dr. Maharaj is going to answer. How does it work if you have existing insurance? Take it away, Dr. M.
So that's a great question. First of all, impact is always secondary to any sort of health plan, insurance, or even any other health sharing that you may have. So we work secondary to that. So for example, let's say I have, I don't know, Blue Cross Blue Shield insurance, and my plan covers 80-20. I'm responsible for the 20%. And I join Impact Health Sharing. Impact Health Sharing would share secondary to Blue Cross Blue Shield. So of course, I go have a see my doctor, the bill is $100. Blue Cross Blue Shield, again, they pay 80%. So they'll pay $80. The 20% is my responsibility. And now with Impact, we would kind of come in for that 20%. So if you've met your PRA, which is what we call our deductible, then Impact's members will share into 90% of that $20. So we kind of pick up where the insurance would leave off, so to speak, and be secondary to that.
Awesome. Thank you.
Mhm.
Next question is for you too. If you have Medicare Part A and B, how will Impact benefit you?
So pretty similar to what I said with the insurance aspect of it. So we do have a Medicare for Seniors program with Impact. You have to be 65 and older, and the only way you can be in Impact after the age of 65 is by having traditional Medicare Parts A and B. And again, we are secondary to Medicare, so we would pick up and share into whatever Medicare has not paid. The great thing with that, with our Medicare plan, is a lot of the other stipulations that we have in place kind of go out the window. For example, the pre-existing stuff that goes out the window once you hit 65 and you're on the Medicare plan. So we kind of work as a great supplement to insurance, to Medicare. If you want us to share into prescriptions, and you also need to have Medicare Part D, and we would be secondary to that. We only have one PRA level, which again, that's what we call our deductible, and it's $1,000. So it's a really great option for those that may not have a means or a way to get other types of supplemental insurance with Medicare.
Awesome. And you touched on this, but I'll let you expand a little bit. If my current insurance doesn't cover the entire cost of my prescriptions, will Impact cover the balance?
We would pick up wherever they have not left off. And I would actually even almost say that I would bet that our prescription program would be cheaper than the insurance, in which case you would say, don't even bother running it through your insurance, just use our prescription program. But again, we would be secondary to them, but with prescriptions, I would almost bet that we'd be cheaper than they would.
Yeah, our wholesale model, it's not a discount program, it's beyond that. It's really, it's one of the hidden gems of Impact Health Sharing. So, all right. So this next question I'll take. In most states, healthcare is required or you're penalized during tax time. How do we avoid that with Impact? And how can we legally explain it to potential customers? Is there documentation Impact would provide? So in short, there's nearly about 30 states that have safe harbor language for healthcare sharing, of which we benefit from. There's really just a handful of states or so that are problematic in that regard. But remember, Impact is not insurance. So in those states, if they do have a penalty, it's just a math exercise, right? You just have to simply, okay, well, what is my impact cost? What is the penalty for that? And is there a savings there over traditional insurance? I can tell you more times than not, it's reported back that it is. So it's just a math exercise in that regard. Back to you with this question. Does a person need a medical exam prior to becoming an Impact member? The answer is no, right?
Correct. Yeah. So another great question, because we do ask you a lot of questions during your application process about your medical history, but we do not require you to get a medical exam. I believe some other healthcare sharing organizations may, but we do not. We kind of go based off the honor system. We expect that you are honest and forthcoming when giving us your medical history. Obviously, we don't share into everything related to pre-existing conditions, which is why that's important. And then just kind of leading into one of the other questions, how are a patient's medical history records acquired if they do not currently have medical coverage? So just to kind of tie those two together. So let's say you fill out your application. Again, we don't require you to get a medical exam. We expect that you are truthful and honest with that. But let's say you sign up January 1st of 22, January 2nd, we get a bill for, I don't know, a knee replacement surgery. That's a little bit odd considering that you just joined the first and all of a sudden now you need a major operation. That would flag our system and we would say, okay, we need to get medical records in order to make a determination or to confirm that this is in fact not related to pre-existing. And the way we would do that is by sending your provider a letter asking for your medical records. So that's how we would go about getting your records. Now, in some situations, a provider will ask that the member sign a release form, in which case we would ask you to sign it and explain to you why we need the records. And then the provider would send that over to us. I would review that and then make a decision about whether or not that's an eligible medical expense related to pre-existing or not. And I think there was maybe one other question that I could tie into this.
13, maybe?
What would be a good selling point? Someone has VA benefits. Yeah, okay. So the question reads, what would be a great selling point to have someone who already has VA benefits, health coverage, to sign up for Impact? And that's a little bit difficult. Well, not difficult, but a little tricky because from what I understand, the VA does have different plans that they offer, sometimes depending on rank and other things, or longevity in the service. So it really depends on what that plan offers. The VA does have some really great plans, in which case, to be quite honest, I don't know if they would necessarily need Impact Health sharing, but it would really depend on what they offer and what they get. If they do have a higher deductible or they have an 80-20 plan and that 20%, it's a little bit tough for them, then of course we're a great option, and no different than what I mentioned with traditional insurance, we're always secondary. So if the member responsibility with their VA plan is something that they would like to kind of reduce the impact for on their end, then of course we're a great option for them. So that's how I would mention that.
For sure. And even if they're not a customer themselves, odds are they're going to know somebody outside of the VA system that needs to reduce healthcare costs. So even if they're not a customer, they can certainly become an IBO, right? And you could partner with them in that regard. And then I got another one here about health spending accounts. First of all, I would say this: we would have you check with your accountant or financial advisor on HSAs. I do know of many members that use HSAs to pay for their monthly share amount and any associated medical bills, but we want you to check with your accountant or financial advisor. Anything you want to add to that, or is that good?
I'm assuming that by HSA, because they wrote health spending account, they meant health savings account. So I'm just going to go based off of that assumption. But yes, you can use your HSA account to pay for your monthly share. It's no different because it's like a routing number or a banking number that you would put in and make your payments. But again, like Phil mentioned, if you just want to be extra sure, I would contact the company with which you have the HSA with just to verify that. But we would most likely qualify for that spend.
And then I have one last one I'll take. It's what's the status of New Jersey, Rhode Island, and Washington being able to offer Impact Health Share? So, if you're a member of Impact Health Sharing, right, and you happen to need Impact in those states, you can use it. We just have chosen not to offer Impact for sale for to members, citizens of those 3 states. We're actually doing a very extensive review. I've just brought in government relations people to evaluate our next option as it relates to those states and a couple others. So stay tuned for more on that one. In that regard, we know New Jersey is the constant feedback I've heard. Not so much Rhode Island, not so much the state of Washington, but New Jersey seems to be the most important one to ACN IBOs. And so our next move will directly affect what we do in New Jersey here in the next few weeks, maybe as much as 30 days. So stay tuned. We still got millions and millions and millions of people to help outside of those 3 states. So wow, this has been awesome. I don't know if there's anything else or any further questions you'd like us to answer. So I'll turn it back to you, sir.